Good afternoon, class. We are going to continue the remaining part of the research design. Okay, so the last class we had already started with the descriptive research design, which is also called as non-experimental design, is it not? And it comes under the quantitative research design. So the next important types of the research design is prospective design. Have you heard about this name, prospective design? Prospective research design is such kind of design where we relate the present to the future. That is what is the prospective design. Relate the present means what? Whatever the cause has taken place, okay? That means in future, whatever cause will takes place, the effect we can see at the present. For example, in the present situation, there is a global warming is taking place. So because of the global warming, what can happen in the future? Lack of oxygen, concentration in the air because of deforestation. Yes or no? Climatic change will be there because of deforestation, weathering of the rocks, removing of the topsoil. Is it not? Excessive flood will come. The places where there is a drought, you will see lot of flood situations are coming in those places. Okay, so like this way, what happens, whatever presently we are performing, and it will have an impact, either a positive impact or a negative impact in the future. So that is what you are procrastinating, you are forecasting that these things can happen in future if we practice our lifestyle in such a manner. Like people who are chain smoker, so present situation is what? They are the chain smoker. What can happen in future? Lung cancer can take place. People who are alcoholic, chronic alcoholic, present situation is they are chronic alcoholic. What can happen in future? There may be liver cirrhosis. So this is what called as the prospective research design, where we are going to relate the present, whatever is present scenario is there, if we relate the present scenario to the future, okay, any actions, any activities what we are doing presently, that we can relate to the future, and that is what is called as the prospective research design. Like I have given you the example, chronic alcoholic, present scenario, in future there will be liver cirrhosis. So if you want to do some studies regarding the way of living, lifestyle of the people at present, you can forecast what are the different kinds of diseases they may land up in future. That is what is called as prospective research design. Understood all of you? Is it clear to all of you? Yes? For example, I'll give you one more example, that those people who are having a lifestyle of sedentary lifestyle, that means they are only sitting, they are using their brain, doing the activities, but not physically. They are doing the activities mentally. The people who are working in the offices, the laborers who are working in the fields, in the construction areas, they are utilizing their physical energy, but not their mental energy. Yes, so we are talking about presently those people who are following the sedentary lifestyle. They may have in future diseases like heart attack can come, atherosclerosis can come, diabetes can come, hypertension can come. Why? Because the body is not in action form. That is why whatever they are consuming, it is getting accumulated in the body. The extra fat, the extra energies are not getting burned out because they are not doing any exercises, not doing any meditations, jogging, free hand exercises or aerobics, nothing as such. So that means what? You are doing a study where you have collected a group of people who are sedentary workers at present, and you are charting down their lifestyle, and you are forecasting that these kind of lifestyle in future will land up with these number of diseases. So this is what is called as prospective kind of study. The effect has not taken place now, only the cause you have identified. Based on the cause, you can tell what will be the effect in future. Is it clear to all of you? This is what is called as the prospective type of study. Now coming to the next part, that is retrospective research design. Just opposite of the prospective. Here what happens? Here the researcher is going to do the studies, the current phenomena by seeking information from the past. That means the effect has already been taken place. Patient is coming to the hospital with the complaints based on which you are going to do the diagnosis. Okay, and when you are doing the diagnosis based on the effects what you have identified in the patient by the subjective data and by the objective data, you are correlating with the cause in the past what has been taken place. You understand? This is what is called as retrospective, going back, retro, reward. We say no, redoing something. So you are going back and you are identifying what can be the cause in past which has taken place, because of which the patient has landed up with this effect at present, with this disease at present. So the same example we can take what we have seen in case of the prospective study. Like I told you, sedentary workers, they will be having these list of diseases if they don't practice healthy lifestyle by doing some physical activities or exercises or pranayams or meditations, taking care of their diet part. Okay. So now the patient who has come to you, he has come with the hypertension. And when you are taking the history of the patient, you identified the cause of hypertension was because of maybe food habit was not good, okay, or maybe because of stress and tension in the office, or because of the lifestyle was not proper, sedentary worker. So what happened? Maybe atherosclerosis has taken place, the arteries are being having lot amount of fatty depositions, that is why there is a pressure of the blood to move, and because of which there is a high blood pressure is taking place. So that means present diagnosis you are identifying based on the cause what has taken place in past. That is called as retrospective. Is it clear to all of you? Yes or no? Fine. And in case of prospective means what? You are seeing presently what are the causes they are performing, they are doing, and what can be its effect in the future. So prospective is from present to future and retrospective is from future, present to the past. You are moving to the past. Okay. So these kind of studies also you can do in the research areas. Okay. Next. Now development research design, it examines the phenomena with the reference to time. Another kind of research design is what? You are examining certain phenomena. Phenomena is nothing but the relationships between the two variables or two or more variables. And the variables are nothing but your independent variable and dependent variable. Is it not? So you are seeing independent variable as a cause and dependent variable as a effect or as a outcome. Okay. So whatever is the phenomena you are going to examine in the research, it is based on the time, reference to the time. These kind of studies. There are some time limits are there, time gaps are there. In that time gap, you are going to do some research study in order to develop the relationship between the variables. Okay. So what are those in that? The first one is coming cross-section design. Cross-sectional design means what? You are collecting the data at a specific interval of time, okay, and one period of data collection takes place at one particular time. Okay, you are having different samples. Okay, for example, I'll tell you, you want to identify the sleeping pattern disturbances of the mothers who are having the gestational age at 3 months, at 6 months, and at 9 months. So what you are going to do here in this study, it is a reference to time. See, I have told you the reference point of time. So you are giving the time. Don't feel sleepy. Last bench boy. Okay, so reference point of time means what? Over here you are giving some time like 3 months, 6 months, 9 months. These are the time period. May not be in hours, but it is in the form of months or in the form of days or in the form of hours. Now what you are going to do here, you want to study the sleeping pattern of the mothers at 3 months of gestational age, 6 months and 9 months. So you are going to collect the sample. Maybe your sample size is for example 30. So what you do, 10 samples you collect from 3 months of gestational period, first trimester mothers, 10 samples you collect from the second trimester mothers, and another 10 samples you collect from the third trimester mothers. And you collect the data from these 3 different trimesters mothers regarding the sleeping pattern disturbances. Is it clear to all of you? That means what? You are not waiting to collect only from one group of mothers, those who have conceived right from the conception till the delivery at 3 different trimesters their sleeping pattern disturbances. You are not doing like that. You understand? You are taking 3 different groups of mothers. Some are at first trimester, some are at second trimester, some are at third trimester. And from them you are collecting the data that what is their sleeping pattern disturbances. Is that clear to all of you? Understood or not? Okay. Now next is what? Longitudinal design. Longitudinal design means what here? You are going to collect the data over here. So here what happens in the longitudinal type of data collection, you are collecting the data for an extended period of time. Extended period of time means what? So same example. The mother who has become pregnant first trimester till the last trimester. It is an extended period. Same sample. You are collecting the data right from the first trimester till the third trimester. So this is called as the longitudinal type of study. You are extending the period till that phenomena gets completed. You understand? So this will take longer period of time. You want to identify the sleeping pattern disturbances of the mother. So you take total 9 months for the same group of mother to identify what is the sleeping pattern disturbances at each trimester. So samples are not being changed here. Samples are the same right from first trimester till the third trimester. So total you are taking 36 weeks. Total you are taking 9 months to complete the data collection. That is why it is called as longitudinal type of study, where you are extending right from the phenomena which has taken place from the starting till the completion or finishing of the phenomena. Is it clear? But in case of cross-sectional was what? Reference to the time. You are not waiting to have an extended period of time to collect the data from the same samples. Okay, right from first trimester till the last trimester. So you are collecting the data by having these samples of different groups. Some are from first trimester, some are from second, some are from third trimester. So now what happens? The 3 different groups you have got, you can finish the study maybe within 1 month, the data collection period, because you are not waiting for the same samples to complete from first trimester till the last trimester. Is it clear to all of you? Yes. So this is what is called as the longitudinal type of study. Now what is trend studies? Trend studies, panel studies and the follow-up studies. Trend studies means what? You are going to see a particular trend, what is following in a specific group of samples who belong to a certain population. Like for example, you want to see the trend of smoking among the adolescent college going boys. Okay. Now you are going to compare this with the previous set of years. Like for example, what was the trend of smoking or taking drugs among the college going students in the year between 1980 to 1990. Okay, 10 years. And you are comparing that trend maybe from 2000 to 2010. What is the trend of the same drug addiction or alcoholism or smoking among the college students? So you can see in the trend study that whether the consumption of alcohol or drugs or smoking has been increased as compared to the previous 1980 to 1990 trend, or it has been decreased. So trend study means you are going to compare a set of years and what was the practices regarding the topic which you have taken is been performed by those group of people. You set a group of people like adolescent or college going students. So 1980 to 1990, what was the trend of consumption of alcohol or drugs or smoking, and what is the trend of the same habits in between the 10 years of duration from 2000 to 2010. Clear? So you can find out the comparison in which set of years this trend has been more increased as compared to the another set of years. So it can be anything. It can be fashion trend, it can be antisocial activity kind of things, what the people are doing nowadays. It is increasing day by day. Okay, it can be the qualification, it can be any other educational style or pattern you want to check how it has been improved, okay, from the last 10 years and present 10 years, and you can compare those things. So that is called as the trend study, because trends keep on changing. Yes, do you agree? Trends, it keeps on changing, it doesn't remain the same, and according to the changing of the trends, people accommodate and adjust their lifestyle, their working pattern, their habits, food habits, sense of dressing, and many other things. Okay, same way follow up studies. What is follow up study? Follow up means the word itself you come to know, already you have given some treatment, you have given some measures, okay, and after some time you are going back to the same population or to the same samples and doing a follow up whether the effect of your treatment or of your intervention become positive or not. Yes, that is what is follow up. For example, when the patient gets discharged from the hospital, they give them a follow up sheet where it is mentioned what are the medicines they have to take, what are the health practices they have to do, what diet they have to consume, and at what day they will come back again for the follow up visit to the hospital. So that means what? You want to check the treatment or the interventions what you have given to the set of samples, okay, and after some time you want to check what is that impact of those treatment, of those interventions, and you will come to know how effective is your intervention or treatment. Yes, if you find that in the evaluation of the follow up the impact is not very good. For example, you all have assessed the adolescent girls, school going girls are having iron deficiency anemia, and you have prepared an intervention where you have shown them some demonstrations of the cooking, food habits, selection of the food materials, all those things, and you have informed them that they should practice at home. So before giving the intervention, you have tested their hemoglobin level in the blood, and you have identified that these many group of adolescents are having mild to moderate anemia. Okay, if it is severe, then definitely you have to admit that particular adolescent girl to the hospital. But mild to moderate can be recovered with the home remedies and the healthy practices. And then you have taught them, demonstrated them what are the healthy practices they must do for the iron deficiency anemia regarding food habits, selection of the food, cooking methods, other things. And after 6 months, you have again visited them and checked their hemoglobin level, and you have found that the hemoglobin level has been increased. So this shows that they have practiced those healthy practices. That is what is called as follow-up studies. Is it clear to all of you? Okay. Now next is epidemiological studies. Epidemiological means what? Something related to the community aspect. It involves investigating the distribution and cause of the disease in the population. Okay, what is the cause of the disease and its distribution in the population? Distribution means what? How many people got affected in the population with this disease condition? Like for example, COVID. What was the cause of COVID and how many people got affected by COVID in that particular population? That is what is called as distribution, means affected people. Okay, so this comes under the epidemiological studies. So you can do some studies like that. Suppose you have gone to a community, same study, and you have find out that one of the major cause of health problem is the iron deficiency anemia. And you see how many adolescent girls have been affected with the iron deficiency anemia. That is what is called as the distribution of the disease among the population. How many of them got affected? And the prospective studies are also known as cohort study, and retrospective studies are also known as a case control studies. Already I have mentioned over here that what is prospective and retrospective studies. So these studies are also having some other synonymous name, that is called as the prospective means what I have told you, from the present you go to future, is it not? So that is also called as cohort studies, and retrospective is from present you go back to the past. It is also called as case control studies. Okay. Now, what is cohort study? Again, you see it is a longitudinal kind of studies, because in cohort studies, what we do, we investigate the disease and the causes for a certain lifetime period. Like for example, you want to check what is the, no talking please, what are the health conditions deterioration takes place among the women between the age group of 30 to 40 years. Okay, and those women who are born in maybe 1980. So the women who are born in 1980 till they reach to their age of 40 years, you have to keep continuing the study. That is what is called as longitudinal study, or you can also call it as a cohort study. So you have to examine, assess each and every stage of their life. What is their educational pattern, what is their food habit, what is their hereditary condition, what are their lifestyles, what kind of job they are doing. Okay, so each and everything when you are studying, you will identify that which woman during this age group of 30 to 40 years has been landed up with some health deterioration conditions. Like for example, there is a decrease in the bone density of the woman takes place after the age of 30. But you may see there are some women whose bone density has not been decreased. Why? Because they have taken good amount of calcium supplements with the vitamin D for making better absorption of the calcium in the body. So this is what is called as the kind of cohort study, where you are going to assess any kind of domains. For example, I told you now health assessment of the women who were born in the year of 1980, and the health assessment you are going to do till their age of 40 to identify specifically what are the health deteriorations takes place between the age group of 30 to 40 years. Okay. Next is case control study. Here again you are going to identify the cause of a disease are investigated after the occurrence of the disease. That is what is retrospective, I told you. Presently you are identifying the symptoms based on which you are diagnosing them, and based on the diagnosis you are going in the past and identifying what may be those causes which they have practiced, because of which today they have landed up with such kind of disease. Clear? Now next is the advantages and disadvantages of the non-experimental design. The advantages are what? It is a convenient method of doing the study, suitable for nursing research because you don't have to take always randomization, manipulation and control. Okay. Next is, it is very simple kind of study, low cost compared to the experimental kind of study. Why? Because in experimental, you have to go for a complete control. You have to set an environment which should be completely controlled so that no intervening or extraneous variables will have an impact on the study variables, that is the dependent and the independent variable. Clear? So that is why you are going for a controlled environment. Maybe you are doing some kind of simulation method in the simulation lab, or you are going to take any other kind of lab where you want to do some investigations by having some chemical combinations, observing through the microscope, and you are drawing the inferences of the observations. So that means you are having a controlled environment there. But here it is not like that. So it is a simple kind, low cost as compared to the experimental design. And what are the disadvantages? The relationship between the variables, what you find is never always clear. Why? Because you don't have control. Yes, when you don't have control over the extraneous variables, there may be chances to develop some of the intervening variables to impact the relationship or the phenomena which you are identifying or which you are examining between the independent and dependent variable. So see that here, their results what you are getting, it is not always 100% correct. Next is it has more error because of non-randomization method, results will be having some kind of error. So next we will see in a very brief, that is types of qualitative research design. The first one we will see from here, basic interpretive qualitative research design. This means what? Whatever the incident have taken place. Qualitative means it is not dealing with the quantity. Remember this thing. Quantitative type of studies are experimental and non-experimental type of studies. Okay. And whereas in qualitative studies, we are dealing with the emotions, feelings, attitudes, characteristics, properties of any individual, of any kind of, setting or situations or the phenomena what is taking place. So suppose if there is a situation is given to you, you need to interpret the situation. That means what you have observed, you interpret in a language form, and that is what is called as elaboratively you interpret, descriptively you interpret by using all kinds of adjective words, okay, and that is what is called as interpretive qualitative study. For example, it can be sometimes the feelings. You have asked the mothers, those children or babies are admitted in NICU. Okay, that what is your emotional status when you see your baby is there in the NICU with lot of tubings on the body, small baby. What is your emotional status? So they interpret what is going on in their mind, and that as a researcher you are going to note it down. At the same time, you keep your recording on to record also the verbatim of the mothers what they are saying. So in this case what happens, you may be collected these informations from near about 10 mothers, those whose babies have been admitted in the NICU. And from these 10 mothers, when you go back to your room and start playing the records, you will identify after listening all the 10 mothers, there are some common viewpoints, common emotional points of all these mothers. That is called the inference what you have drawn. Okay, and that can be also developed in the form of theory and you can generalize it. Phenomenological studies are also here. We are explaining the essence or the structure of any complex meaning. Okay, that is what is called as phenomenological studies over here. And also one more thing I would like to say, in phenomenological studies, the researcher should avoid bracketing. Bracketing means what? Putting forward the researcher's own concepts or views about that particular situation. If the researcher is having negative attitude or preconceived idea about any situation on which the researcher is going to do the study, then definitely the study will not be positive, because your attitude itself is coming in between the study. So whenever the researcher does this kind of phenomenological study, they have to do the bracketing. That means the mind should be open, there should be no negative, there should be no positive thoughts or attitude or concept or ideas about that particular situation on which they are going to do the study. Then only the study will be biasless. Otherwise, you will be biased. When you are going to write the report, you will be biased because in your mind that preconceived idea about that phenomena or about that situation is already there. So bracketing need to be done. Grounded theory means what? Again, it is the same. You are going to identify the feelings, okay, or the emotions or the attitude of the samples regarding a particular situation, and you are drawing the inferences from them by asking them open-ended questions, recording them, coding them, and then you are analyzing the findings, which can be also generalized and the theory can be developed on that. For example, the theory related to mother's emotion, those mothers whose babies are admitted in the NICU with such kind of diseases. Case studies, all of you know what is case studies. You do the case studies, you take up the case, you give care to that patient, okay. You also write their nursing process, you also do the health, give the health education, administer the medicines, and you do all possible things related to the patient in a holistic approach, okay. So in the case study method, you are going to analyze in a descriptive way that what are the treatment modalities, what are the care is being given common to this group of patients for whom the recovery was very faster. So you can take the record from the record room of the medical section, like how many cases have come to the hospital regarding any XYZ disease condition, and you go through their, you know, their case papers, case files, and you see what kind of treatment they have received, okay, whether it is the same kind of treatment given to all the patients of the same disease condition, or there were some variations because of the clinical differentiation in their diagnosis. So that has to be taken care. So at the end, when you study all these data of the different patients of the same disease condition, and then you come to a conclusion by doing a meta-analysis that what are the common things you have found out among these number of patients in the case study of maybe diarrhea, cholera, typhoid, whatever disease condition, and you can draw the inference related to their recovery, related to their complications, related to their treatment modalities, nursing care given, and the follow-up process. Okay. Ethnographic studies means what? It is the traditional method of doing the studies. Whatever the individuals or the group of people are practicing in the community, you are going to check it out, assess it, but without going for the further investigating that why they are practicing this kind of things. Narrative analysis, you want to narrate in detail with the descriptions, okay, regarding any situation or phenomena or circumstances which has taken place. Narrative, it is called as. So with this, we have completed the different kinds of qualitative type of study, okay. Now, lived experience of the people. One more last thing. What is lived experience of the people means? You want to check, okay, whether the people who have developed some kind of chronic diseases, irreversible diseases, like for example renal failure, it is irreversible, is it not? They have to go for dialysis. For example, you have diabetes, it is irreversible, people can't be treated where the people become completely all right and get rid of diabetes. Hypertension, so these are irreversible diseases, but when the person have landed up and diagnosed with these kind of chronic irreversible disease, what is their experience, life experiences, how they have accepted it, because after getting diagnosis their lifestyle gets completely changed. Is it not? They were not like how they were practicing freely. They have to be in certain boundaries of diet, of exercise, of sleeping pattern, is it not? Of living style, everything gets changed. So how the person is getting accommodated, accepting and compromising with the disease and going forward with the disease, but trying to maintain the level of that, you know, maybe the blood sugar or maybe the blood pressure, so that it should not get elevated. So for that also they have to go for the healthy life practices. So this is what is also important, which we study in the qualitative type of design, that is the life experiences of the people. Clear? Understood? Okay. So with this we will complete the class here.